Hello, this is Dr. John Dye. I'd like to take a minute to share with you and give you an overview of my workshop I call Practicum in Mind-Body Healing. This workshop is designed to be taken over a weekend on a Friday night, Saturday, and Sunday. Of course, it's originally designed as a course at Southwest College that I teach there over a 10 to 11 week period. But I've condensed and adapted it so that it could be taught in a weekend. What you will learn in this workshop are some very powerful techniques and skill sets that I have found very effective in my practice. And there will be opportunities to directly experience them, to have them demonstrated, to have breakaways where you get to practice. And the workshop will include very detailed instructions and handouts that take the participants through the various techniques and processes step by step by step. First, Friday evening, I'm going to introduce something I call the mind-body interview. And this is a way of interviewing, listening, having a conversation with the patient that takes them from right where they're at and helps you and them together explore the maybe the deeper realms of meaning, of the meaning of their symptoms, of how they hold it in their body and in their thoughts and their emotions. In the mind-body interview, something begins to emerge through your listening that I call the narrative. It's usually a story that they have told many times before in their life, and it kind of is a recurring theme for many people, this narrative that defines the life and the meaning of their life. So in listening empathetically, you'll eventually come about what will just emerge from the conversation is what I call a clinical target memory. And that memory will be a more specific time or an event, certain people, who was there, what happened, and you'll ask questions about that with the primary focus less on the triggering event, but more in the depth of the experience, how it affected you, your client, what it meant to them, how they behaved at that time when that thing happened or when that person treated them that way. What were the emotions that went with it? How did they feel in their body, either then or now as you do the interview? Where do you feel that in your body? So that the interview looks at the symptoms being triggered by that particular clinical target memory. In the course of getting a good mind-body interview, we will explore ways of measuring the intensity of the reaction. So the intensity in the body at that time might be a more detailed description of how that feels. When they describe the emotion or the event, what do they feel in their body? You'll ask. And where do you feel that? And if that were a sensation, is there a metaphor that goes with that? And the shape and the size and the color and the intensity and the volume and the temperature, all of these things can be used to measure and in some way quantify the symptom. And through the course of therapy, of course, these symptoms tend to diminish or even in many cases completely clear altogether. The interview will also look at what we call subjective units of disturbance related to certain emotions and stress patterns, so that you might interview to ask, when you think about what happened, if the intensity, the worst it ever was, or perhaps it's as bad as it was when it originally happened, in this moment, right now in the room, listening to me interview you, how high does the intensity of that go? And we'll call that subjective units of disturbance or SUD units. And 10 would be it's as bad as it ever was. And 0 or 1 would be pretty nominal or non-existent lingering symptom. So as we interview, and the skills of interviewing and in some way monitoring the intensity of their investment and the story that goes with it and the particular behaviors and patterns, we will then explore what I would call the desired state. We'll look at what would it be like if you didn't have to react this way or that. If you could be more neutral, or if you could be more in your heart, or if you could be more powerful or more effective in your skill. And it's almost, sometimes we'll almost do it like if you were the author of the narrative, if it's your story and you've just seen it up on the stage, if I gave you the assignment to rewrite that story, how would you rewrite it so that you feel good about yourself and the role you played and you're pleased with yourself? And as the story changes in the course of your interview, the physiology and the way the memory is stored and the meaning of the memory changes. So that in the course of the work that we're doing, people actually do have significant change in their symptoms and thoughts and moods and behaviors. At the point that we're rounding out the mind-body interview, there's now a possibility to use various techniques that we will teach in the workshop. And one of those techniques is called holographic, or I sometimes call it holographic imagery or holographic clearing technique. And we'll ask the patient to describe the sensation inside as if it were a metaphor. We often use this technique when there is a lot of somatization, when the patient is holding tension and energy in their body and it's actually producing symptoms like a lump in the throat, or maybe a knot in the stomach, or a headache, or a backache. So by describing the sensation, we'll invite them to use their imagination and describe it as if it had a shape or a color or a volume or a temperature, using metaphors. And somehow or other, in the course of developing these metaphors to describe the sensation, we're also cultivating within this patient the ability to become the witness or the observer, and to step back and maybe be a little more neutral in their role as the observer. And in that we find the story starts to change, and we'll invite them to intentionally change the story. And as the perhaps a whole invented new story about how they would rather have behaved or react in that situation. As that emerges, and they take a picture of it and they breathe it, we actually have them breathe the sensations as they look at this image installed onto the wall of their mind, breathing it and infusing it through the body. There's a shift that happens, so that when we actually come back now to revisit the original toxic memory, the sensations by and large, as a rule, are diminished. And in fact, after a few rounds, more often than not, they're completely disappeared and dissolved, along with the intensity of the emotion that went with that memory. A lot of times when there's somatization and tension in the body, we will use a holographic technique. Your notes in the workshop will be detailed, step-by-step protocols, how to conduct the interview and how to run through 2 or 3 or 4 rounds of this process. On the other hand, in some other cases, we might choose to use a technique such as emotional freedom technique. We will learn this technique in Saturday afternoon in the workshop. And with this one, there's some tapping where we tap on acupuncture or meridians, and along with reciting some affirmations, some beliefs, and installing the new image or the new memory through the technique of the tapping. It's possible that the emotional charge is also released. And with the emotional freedom technique, we especially find it valuable for forgiveness, for people to tap in and release and have some more positive, unconditionally kind or loving regard for themselves or others. And that naturally emerges once we've done the complete mind-body interview and they've had a chance to look and see it from different perspectives. Often the sub-units, the subjective units of disturbance, just go to zero after using a few rounds of EFT. In the workshop, you will learn to do a step-by-step protocol to implement a technique such as that. And there's another process that we call EMDR. It stands for eye movement desensitization. No, eye movement desensitization and reprocessing. It was originally created and formalized into a method by Francine Shapiro. And I will make a clear distinction that there are official workshops where you can learn EMDR through emdr.org. When I present it, I am presenting my own version of eye movement therapy. I give reference to the EMDR organization, but in no way am I able to duplicate or present or certify you in any way in that technique. But people who take the workshop will learn the principles and learn how to use eye movements in a way to help clear traumatic memories. Often when a memory is stored, that is stored in a way that is filled with the original trauma. Traumatic events and painful memories sometimes get stored dysfunctionally, so that even one little piece of that memory tends to bring back and cause a person to re-experience much of the intensity of the original event. And we find that with the eye movement therapy, there is a reintegration of sorts where the memory is changing. Once again, the memory changes, the way it's stored changes, new insights get infused into the memory, and over time, in much the same way as we do with holographic and with the process of EMDR or EFT, all of the techniques do something similar in that we're infusing insight, new thoughts and concepts, new memories into the mind so that the original trauma, the original somatic experience in the body, the original judgment of oneself and others seems to just clear in the process. So we will practice and use these techniques that include eye movements, tapping, and imagery to have you in the workshop develop several different options of how to approach what we might call brief therapy. This ability to take a client through a healing process in only a few visits. In many cases, in 1 to 6 visits, there's dramatic change that can happen in a client that has significant mental emotional diagnosis. So once again, I will promise that participants in the workshops will not be required to be the client or to reveal or share their emotions any more than they're comfortable. People who volunteer to be a subject or a patient, someone else will volunteer to be the practitioner, and someone will be the observer who takes notes, so that I will reassure people that there's no pressure, that people will only participate to the level of their comfort. But everyone, regardless, will come home with very detailed instructions, step-by-step protocols that you can put in a binder and be able to pull out and use in your practice, or practicing with friends and classmates, or those that are ready can go right into practice after the workshop. I look forward to sharing these skills and techniques in a way that pertains to a medical practice, learning how to chart and how to make use of all these skills, I promise you a rewarding experience. I look forward to seeing you in the workshop. Thank you.